So guys, loads of you have sent me a controversial interview on GB News with the Fat Doctor. Yes, that is what she calls herself. That is not me just being rude. So she made some very, very controversial statements. I'm going to dissect each part of the interview bit by bit and give some cold hard evidence on why she's wrong, and actually in some cases right as well. So let's start from the top.
I'm fat because I drink too much red wine and I don't exercise enough.
That's not true. You're not fat because of what you eat and how much exercise you do. That is the line that everybody is led to believe.
Left you now.
So, what she states where you're not fat because of how much you exercise and what you eat is insanity. Factually, it's correct. You are overweight because of what you eat and how much you exercise. It is calories in versus calories out. It's energy balance. How you do that is nuanced. But if it boils down to very, very simply, are you burning more calories than you're consuming?
Ran up and down Leicester Square for 3 hours and then went home and had a piece of lettuce and then came and did the same tomorrow and the day after that and the day after that. I would start to look like a supermodel.
Only for a few months, and then you would stop. In fact, you would start regaining weight within the first year. That is a fact. That's not fiction. That is an absolute fact. And there is literally no evidence.
So, in terms of what she stated about putting the weight back on, yes, happens all the time. Particularly when the presenter is eating and training like that, doing something that is very, very unsustainable. You will put the weight back on. Would it look like a supermodel? Depends. Supermodels do look like that now. But what she said is very, very true. You probably will put the weight back on by doing something like this.
Literally no evidence that weight loss is going to benefit anybody's health, whether they're a child or an adult. I'm willing to stake my medical career on the fact that that the lies that we've been sold about obesity, especially childhood obesity, are not true. They are there to benefit the weight loss industry, not to benefit children. Evidence is very clear. Up to 9.
So, this is the worst statement she made, that there is no evidence that losing weight will improve your health or change your health outcomes. The fact is, obesity is the second biggest cause of cancer. Number 2, obesity. You don't get told that, they hide it from you. Also, obesity increases your risk of heart disease by 26%. Regardless, actually, of your cholesterol or your blood pressure. Obviously, being obese is going to increase your blood pressure, or most likely increase your blood pressure, and skew your cholesterol. But if you just remove that, you had healthy cholesterol and healthy blood pressure, that in itself increases your risk of heart disease by 26%. And heart disease is the biggest killer in the UK. A doctor stating these facts should have their medical license revoked. It is absolutely disgraceful saying things like this.
98% of people that attempt weight loss will have regained all the weight within 5 years. That is up to 98% of people, and that is absolutely unquestionable.
So what she states here, where she says 98% of people regain the weight after 5 years after dieting, or within 5 years, sure is true, but she's nitpicking information, cherry-picking what suits her to protect her own ego. The fact is that yes, 98% of people will regain the weight after 5 years, but that is because they've treated the symptom, which is being overweight, rather than the cause of them being overweight. Of course, you do a diet like the presenter said, eating lettuce leaves and running, which is what most people do. Of course, you end up going back to what you were before because you haven't actually dealt with the actual issue, which is your emotional attachment to food, stress eating, and also the fact you haven't changed your dietary habits. You haven't created good quality dietary habits that makes the diet easy to stick to long term. In conclusion, the Fat Doctor is stating that cold hard facts backed by mountains of evidence are not true, such as no evidence that weight loss will help your health. Madness. Or you're not overweight because of what you eat or how much you exercise. I can't believe what I'm hearing. Making dangerous statements like these should have your medical license revoked. The fat doctor, rather than making positive change herself, she's denying reality to protect her own ego. She is also cherry-picking data such as the reason 95% of people who lose weight put it back on within 5 years because they've done it well with an unsustainable diet that can only last so long. They've not dealt with underlying issues that have caused them to be obese in the first place. One of them being whenever they get stressed, they binge eat, as they link food to comfort. They also need to build a diet that is sustainable long term. We have so many people come into BTX and say this is the best diet for them, and they try to order us around. Then I ask them, why are you fat again? The best diet is the one you can stick to long term. You're treating the symptom, which is being overweight, rather than the cause. The cause of them being overweight is unsustainable diets and linking emotion to food. Same as Western medicine, when someone has high blood pressure and is 130 kilos, rather than treating the cause, which is being overweight, they just give them blood pressure medication. Telling somebody to just eat less and move more is not helpful. You need to treat the cause, not the symptom, for long-term sustainable change.